understaffed hospitals and unnecessary procedures are just part of the healthcare crisis Americans are facing. Well, Dr. Evan Levine is on a mission to stop abuses in our medical system, and he has penned a new book called What Your Doctor Won't or Can't Tell You. Dr. Levine, good morning.
Good morning, Ann.
You are a practicing cardiologist. You've been doing this for 14 years, and yet you have written a book that basically criticizes the entire medical industry, hospitals, drug companies, doctors. You're saying they're all putting profit ahead of what's in the best interest of patients. What are you seeing from the inside to justify your perception of that?
I can tell you that all the listeners out there right now who are taking prescription medications, that many of them are spending 2, 3, 5, 20 times more, perhaps, than a medication that is just as good or if not better for them. So there's an example how we're getting ripped off by the pharmaceutical industry. People are getting tests performed on them by physicians who are either practicing medicine, defensive medicine, because perhaps they're afraid that they'll get sued by a malpractice attorney, or by some physicians that are looking to make a few extra dollars.
You're saying the fix of this is that Americans have got to step in themselves and take charge, and you've got some specific things that you think might help. First of all, you say that we need to know that it's hard for good doctors to survive, and one of the reasons why is that you're saying that they're not paid enough. Now, come on. You just said that we're paying so much money for medical care. So justify that statement.
Well, it depends where you think, where's the money going? The money's going to big business, pharmaceutical companies, hospitals and hospital administrators, and duplicitous physicians. The good doctor, the hard-working doctor, he doesn't do that. And yet his fees are controlled by the HMOs out there. He has a fixed income. And we all know that his malpractice insurance is increasing.
So what are you saying, that we need to basically be willing to cough up, pay more to a good doctor, right? Is that what you're saying?
No, I'm not saying that. You shouldn't cough up more money to pay a good doctor. In fact, I would never go to see a physician who doesn't accept your insurance. But find out, is that doctor board certified, where he went to medical school? And find out what hospital he admits to. That's very important. Do you want to go to a physician who admits to a small community hospital, or one that admits to a large university hospital that's affiliated with a medical school?
You also say that people need to know, that we consumers, I guess, of medical care need to know how to avoid getting ripped off. And that's a big question, because we're scared. We don't, we're being told we've got a diagnosis. We don't know how to protect ourselves in this way. What's your best advice?
In one chapter, I discuss get a second opinion. For God's sakes, if you're going for a surgical procedure, and your physician tells you, you have a 10% chance of dying for this test, why not get a second opinion? It makes sense. Or God forbid you have cancer, and your doctor wants to give you this chemotherapeutic drug. And by the way, he's going to give it to you and sell it to you as well. Go get a second opinion. Find out if you should have that procedure or receive that chemotherapy.
What about how to choose a hospital? That's another major decision for a person who is needing medical care. What's your best advice on knowing what a good hospital is and what a bad hospital is?
My bias, and a lot of people aren't going to like this, but my bias is to go to a university hospital.
Why?
Where there are medical students, residents, and ICU staff that are there 24 hours a day. If you get sick in a medical bed in a community hospital, it may be you and the nurse. In a university hospital, there's a medical student, a resident, and an ICU attending there all hours of the night. For me, if I get sick, I want to be in that university hospital.
You know, you are saying things this morning that clearly are not going to make you popular with some doctors and some hospitals. Why do you continue to say them, and what kind of feedback have you gotten because of what you're writing and what you're saying?
I think the good doctors out there and my friends tell me that it's something that needs to be said. So I'm trying to do the best thing that I can. I know there are going to be a lot of people out there that won't be happy.
But you're trying to reach out to the people who need medical care, and so let them have more power. Dr. Evan Levine, thank you so much this morning. And we should tell people that if you would like to find an excerpt and read it from What Your Doctor Won't or Can't Tell You, you can find it on our website at today.msnbc.com. And we're back in just a moment, but first, this is Today on NBC.